Good afternoon, everybody. My name is Henry Liu. I'm here on behalf of Hoag Hospital, and thank you for taking time out of this day to come hear about the new Medicare benefits that are being rolled out by the various health plans that we are contracted with. So without further ado, I'm going to get started here, and then we'll get you to the meat and potatoes of the presentation. This is the agenda for today. I'm going to share a little bit about Hoag, some of the information we have regarding the hospital and the medical groups. Then we're going to give you a Medicare overview, and then we're going to talk about the Advantage Plan introductions. About Hoag. Most of you know about Hoag. There's two hospitals, one in Newport Beach, and we have one in Irvine. We have 14 urgent cares, 9 health centers throughout the county. Hoag's medical staff includes more than 1,700 physicians and represents 52 different specialties. Hoag includes 5 specialized institutes of excellence: neurosciences, cancer, heart and vascular, women's, and orthopedics. Hoag is designated as a magnet hospital as part of the American Nurses Credentialing Centers and Magnet Recognition Program. We were also ranked as the highest hospital in Orange County by U.S. News and World Report for 2021 and 2022. Hoag is committed to providing health care in the communities we serve through our Hoag Health Centers. We're in Aliso Viejo, Costa Mesa, Foothill Ranch, Huntington Beach, Irvine, Irvine Woodbridge, Irvine Woodbury, Newport Beach, and our Tustin Legacy Center. Our urgent cares. We have urgent cares that are open 7 days a week and all throughout from Aliso Viejo all the way through Tustin Ranch. We also have a Hoag Flywell Clinic now open at the John Wayne Airport in Terminal B, pre-security. Access to primary care. How do you get to see our physicians and utilize our hospital? One is through our primary care physicians, through Hoag Medical Group, and through Hoag Physician Partners. And that's our IPA or medical group that we established in 2019. Hoag Medical Group has primary, urgent care, and specialty physicians. We have over 100 physicians, 21 primary care locations, 13 urgent care locations, and you can look at our information on our website listed on the information here. Hoag Physician Partners is our contracted physicians, and there are 10 primary care physicians, over 350 specialists service managed care patients, and you can also find their information at hoaghealth.org/HPP. Here's a little information, an overview of Hoag Medical Group. We have, once again, I mentioned over 100 physicians with specialties from family medicine, geriatrics, endocrinology, all the way through to palliative medicine. We're located in Aliso Viejo, Costa Mesa, Fountain Valley, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine, Laguna Beach, Newport, San Clemente, and Tustin Legacy. Some of our features are same-day sick appointments if you're an established patient. We accept most major HMOs, PPOs, and Medicare insurance plans. We really focus on patient care, unrushed, personalized visits. Hoag Physician Partners is our independent physician association, contracted physicians. We have 10 primary care doctors, over 350 specialized or specialist physicians representing over 50 specialties. Our recent additions include Orange Coast Women's Medical Group with over 20 OB/GYN physicians at 6 locations, providing an integrated care model for women as they move through all stages of their lives. We also have our Hoag Gynecologic Oncology, and we also have Hoag Urologic Oncology, and access to the Hoag network, including the Hoag Health Centers and Hoag Urgent Care. Our customer service number is listed, 800-369-9247. Today, we're going to have presentations from the various health plans: Blue Shield of California, Scan Health Plan, and United Healthcare, and Anthem Blue Cross. And next, I'm going to introduce Jan from Paterka Insurance Services, and she is going to present to you an overview of Medicare. Thank you very much for your time, and enjoy the information that's going to be provided to you.
Good afternoon. My name is Jeanette Paterka. I'm with Paterka Insurance. I am a licensed insurance broker, and I am here to discuss an overview of Original Medicare. Before we get started, I want everybody to be aware there is a link in the YouTube format that you have on your screen. If you connect to that link, you will be able to open up this grid where you can write down information as we go through the various Medicare Advantage benefits. So with that, this is your Medicare health insurance card. The Medicare card, when it says new Medicare card on the top, the reason for that is a couple years ago, Medicare changed the Medicare identification number. You can see there, it's an alphanumeric number, 1EG4, that particular number. It used to be an individual social security number. So you will need this card when you enroll in any type of Medicare, Medicare health plan or Medicare Part D prescription drug plan. What you want to note on the card, it has your hospital Part A coverage effective dates and your Medicare medical Part B coverage effective dates. You're going to need these dates as well if you enroll in a plan. So what is Medicare? Medicare is health insurance for the following individuals. If you're 65 and older, or if you're under 65 and you have certain disabilities, if you have end-stage renal disease, which is basically you're on kidney dialysis, or if you have been diagnosed with Lou Gehrig's disease. If you fall into any of these criteria, you are eligible for Medicare. There's different parts to Medicare. Part A covers your hospital care, skilled nursing facility. I like to think of it as when you go into a facility and you receive services. Part A covers the actual facility charge. Part B covers the medical services you receive. So that would be doctor's office, outpatient care, home health services, labs, testing. Those would all be covered under Part B. Part C is Medicare Advantage. The plans that we're going to hear the benefits from today are Part C Medicare Advantage plans. They have a contract with Medicare to offer private insurance plans to individuals that qualify to be on Medicare. The ones here today are Medicare HMOs. They call them MAPD plans, Medicare Advantage prescription drug, which means it's the health benefits and the prescription benefits rolled all into one. But there are other types such as Medicare PPOs as well. And then there's also Part D. In 2006, Medicare introduced drug coverage to Medicare beneficiaries. These plans need to be purchased separately if you have original Medicare or if you have a Medicare supplement and you need to add your Part D. So the different ways you can get your Part D is if it's already baked in or included in your Part C plan, or if it's standalone, you could purchase a Part D plan. There's different parts of Medicare, and then there's also different ways to obtain your Medicare benefits. So for Part A, Original Medicare, most individuals will qualify at no cost for Part A. What the qualification is you need to work 40 quarters or 10 years total in your working career. If you meet that criteria, then there is no charge to Part A of Medicare. But if you, say, don't have the full amount of quarters, you may have to pay for your Part A. But if you have a spouse that works and is paid into the system for the minimum amount, the 10 years, say if you're a stay-at-home parent and your spouse has worked for 10 years or more, you have not met the criteria, but they have, you will qualify for that Part A at no cost as well. Part B, all Medicare beneficiaries must pay their Part B premium. I know this is confusing, there's lots of alphabet letters, but Part B, remember this, is not an option. It's dependent upon your income, what the premium is. If you're a higher income earner, you're going to have a higher Part B premium, and it is not an option. If you're opt-in to Medicare health benefits, you must have Part B of Medicare. And then, as I mentioned earlier, Medicare Part C is Medicare Advantage. That's offered through the private insurance companies. And sometimes there is a premium, but it can go actually very low all the way up the scale as far as the premium. It just depends on the area that you reside in. And then Part D of Medicare, those have to be approved by Medicare, which is CMS. And these plans, as I mentioned earlier, are offered by private insurance companies. So I referenced the Part B income-based premiums. The new information for 2022 is not available yet, but this is the grid for 2021. So if you focus on that second section where it says 88,000 or less, or 176,000 or less. What this is the adjusted gross income for either a single individual or a couple, and it's based on how you file your taxes. So if I was a single individual and my adjusted gross income was 88,000 or less, I would pay $148.50 in 2021 for my Part B premium. And as you can see, as you go down the grid, you potentially, if you are a higher income earner, you can pay up to $504.90 for your Part B. And this is per individual, it's not per couple. Part D also potentially has a premium. If you're in that first segment, that first level, that 88,000 or 176,000 or less adjusted gross income, there is no additional premium for Part D. But if you are one of those higher income earners, you will also need to pay an additional premium for your Part D prescription drug coverage. Okay, let's talk about enrollment periods. So what you need to remember is this is original Medicare, and there's so many scenarios. So this is specific to original Medicare. So if you're new to Medicare and you are going to enroll in Medicare when you turn 65, you have a 7-month window. You have 3 months prior to the month of your birth month. You can see their birth month 4 is your birth month. You have 3 months after your birth month, and this is when you want to apply for Medicare. What I would suggest if you want to have your coverage start the month you turn 65, it always starts the first of the month. So if my birthday was on the 15th of October, my Medicare when I turn 65 will actually be available to me on October 1st. So you want to go ahead, you want to contact Social Security and let them know that you'll need to fill up some forms and you want to activate your Medicare benefits. I would suggest doing that approximately in month 1 in this scenario because it can take Medicare a little bit of time to get your Medicare card to you. So enrollment periods, the annual election period. This is the time of year that individuals that are on Medicare currently are able to make a switch to their Medicare health or prescription drug plan. The plans that are going to be speaking today, the Medicare guidelines allow them to start talking about the new benefits that will be effective on January 1st of 2022, but they are not allowed to accept any enrollment forms until October 15th. That period is October 15th to December 7th. That is the time where you need to be a good consumer for yourself, be your own advocate, and you need to take a look at the plan that you're currently on and decide if that's the plan that you want to continue in the next year. In October, you should have received what they call an annual notice of change from your Medicare Advantage plan or your prescription drug plan. That notice of change, the ANOC, annual notice of change, will outline what your current benefits are and what the changes are for the upcoming year. And as I mentioned, if you submit an application between October 15th to December 7th, that will be the time to submit the application, and it'll be effective on January 1st. You can change or enroll in a prescription drug plan, you can change your Medicare Advantage plan, you can return to original Medicare, and you can pick up a Part D prescription drug plan. The next enrollment period is called the open enrollment period, the OEP, and that is from January 1st to March 31st. If you're enrolled in a Medicare Advantage plan, it gives you a one-time opportunity between those dates to switch to a different Medicare Advantage plan. You can drop your Medicare Advantage plan and return to original Medicare, and you can sign up for a standalone Part D plan that will go along with your Medicare Advantage plan. Say if you submitted an application in January, it's going to be effective on February 1st. If you submitted an application, it's going to be in March. It is going to be effective on April 1st. So that'll be the time. It's always the first of the following month that the new application will be effective. And then once you are on a plan, as of the end of March, you are locked in, whichever plan you're on in March, the very end, you're locked in from April 1st to December 31st, and you must remain on that plan until the end of the calendar year. But there are a few special elections, they call them special election periods, basically special reasons that you are able to make a change outside of that lock-in period. Some of those situations are if you move out of your current service area. Medicare Advantage plans are based by county. So if you live in, even if you live, say, in Orange County, you move to San Diego County, you need to re-enroll in a plan that is based out of San Diego County. You can also enroll in a Medicare Advantage special needs plan. Some of the plans that we are going to be talking about today, they're not going to outline those plans, but they do have special plans for individuals that have certain chronic conditions that could be maybe heart disease or diabetes. Individuals that are full dual beneficiaries, what that means is they have Medicare and Medi-Cal. So Medicare, the federal program, Medi-Cal, the state of California program, or individuals that are low income subsidy. I'm going to talk about this a little bit more in detail, but they're individuals that are not on Medi-Cal, but they are at a lower income. If you fall into, these are the most common categories, one of these categories, you are able to make a change throughout the year to your Medicare plan. Okay, prescription drugs. This is the first information. As you can see, I have highlighted in red. The items highlighted in red are actually information that has already been released. They release all of the different details slowly between now and the end of the year. But this information is the new 2022 information for prescription drugs. So you have to remember this is a baseline, the standard, the baseline that Medicare requires. The plans you're going to hear today, many of them have benefits better than what this is, but this is the minimum coverage Medicare requires. So after you pay your annual deductible, so you go to the pharmacy in January, maybe even into February or March, and your total cost has to add up to $480. So basically you pay the first $480. And then once you hit that number, you move into what they call the initial coverage limit. That number is $4,430. The way that after that deductible it's calculated is that you take your prescription drug cost. So in this example, it's a $25 prescription. If you have a $5 copayment and your insurance company pays $20, that $25 is put towards the $44.30. And then once the total combined drug cost that you've been paying throughout the year, it accumulates throughout the year, hits $4,430, you move into what they call the coverage gap or the donut hole. This is a new phase that you'll be moving into in a different way that your prescription drugs are calculated as far as the cost. So once you hit the $4,430, you're going to pay 25% for generics, and you're going to pay 25% of your name brand prescriptions. And then once your amount totals up then again to $7,050, you go into what they call catastrophic coverage. So your total yearly out-of-pocket drug costs, when they hit this number, then you're going to pay $3.95 or 5% for generics and $9.85 or 5% for all other drugs in 2022. I mentioned earlier Low Income Subsidy. This is a federal program, and it is for individuals that don't qualify for the state Medi-Cal program, but are on maybe a low or a fixed income. What you do is you go to the Social Security website, and you put in Low Income Subsidy or they do have a button that says extra help. I would advise, if you're on a lower fixed income, to go in and check the levels of of what your income can be for this program. If you're even maybe a little bit over and you think you won't qualify, I would invite you to submit an application, and they'll get back to you quite quickly. There might be certain things that you are calculating into your income that they do not calculate. So if you think that you are close, submit your application. It's online at Social Security. It's ssa.gov. And if you qualify, you're going to pay $0 for your generic, $0 to $395, and $0 to $985 in 2022. So it's basically an assistance program to help you pay for your prescription drugs. So with that, this is the Medigap comparison table. So what this is they have different exchangeable names for this. It's Medigap, it's called Medicare Supplement. Basically, you can purchase, it's a monthly fee, a monthly cost, you can purchase a Medicare Supplement or Medigap plan, and that plan will help fill in the gaps, the items that Medicare does not cover. So Medicare doesn't cover everything at 100%, and we're talking about original Medicare. So in this scenario, you can see all the way to the right, Plan N. If you take a look at that, you can see that it covers the majority of the benefits, and it'll fill in all the gaps. But if you take a look at foreign travel, it'll cover up to 80%. So the thing to remember with a Medicare supplement plan is that you want to take a look at the rating. There are ratings on the internet or within specific insurance companies. You can look up their rating. You want to see how they're rated. You want to take a look at the premiums because it's standardized. So a Plan N with Blue Shield of California or a Plan N with Mutual of Omaha, the benefits are identical. So, but they can have a different premium per month. So you want to also take a look at the premium and then the stability of the company. So Medigap, Medicare Supplement Plan, you would want to purchase this, and then you would need to purchase one of those standalone Part D prescription drug plans. Take a look at the box on the right in the red. There was a Medicare from time to time reorganizes or changes their plans. So back before 2020, they removed Plan C and F for new individuals that are eligible for Medicare. So if you're still working, and say if your Medicare eligibility, say you turned 65 in 2019, but you're still working and you're covered on your employer group plan, your eligibility for Medicare was prior to 2020. So you would still be able to purchase a Plan C and a Plan F. So with that, this is the time you want to go ahead and pull out that grid, because I am now going to introduce Diana No with Paterka Insurance, and she is going to review Blue Shield of California. Thank you.
Good afternoon, everyone. Thank you so much for tuning in today. Once again, my name is Diana No. I am an independent insurance broker, and so for today's session, I will be representing Blue Shield of California. My contact information will be listed in the chat box, but for folks who are not viewing this session live, my telephone number is 949-226-4064. So a little bit about Blue Shield of California. We are a not-for-profit company based here in California. We've been in the industry for over 80 years. We offer a variety of products such as a Medicare Advantage plan, Medicare Supplement, as well as prescription drug plan. So what does that mean for you? We are a one-stop shop. We'll have a plan that will fit your budget and your needs, just depending on what you're looking for. Okay? So for today's session, Blue Shield does offer a variety of Medicare Advantage plans, but for today's session, I will be reviewing their leading plan, which is called the Blue Shield Inspire. So you see on the screen here, there's some of the benefit highlights, but I will take a little bit of a deeper dive in going over the benefits for you. So as Jet mentioned, don't forget to take out your little spreadsheet or so you can follow along because we're gonna zip through this, alrighty? Once again, the plan is called Blue Shield Inspire. It is a 4-star plan. Besides your Medicare Part B premium, there's no additional premium for this plan. You continue paying your Part B, and it's a 0 premium to enroll into this Blue Shield Inspire plan. As for your primary care visits and your specialists, so like your cardiologist, gastroenterologist, it's a 0 copay. Your maximum out-of-pocket is $7.99. What does that mean to you? This is the most you'll pay out of pocket for your medical expenses, so you do have a safety net. So $7.99 is your maximum out of pocket. My apologies, I forgot to mention, I am reviewing the plan benefits for 2022. So this was just released October 1st. So the plan benefits that I am reviewing today is for 2022. Moving on, so hospital copay, it's a 0 copayment. So for unlimited days, it's a 0 copayment. Let's say you visit the emergency room. There is an $85 copay for the emergency room. However, if you're admitted into the hospital, that is waived. I also want to mention, with this plan, we do offer worldwide coverage. So what does that mean to you? Let's say once the pandemic is over and you're traveling outside the United States or maybe domestically, you are covered at unlimited expenses for emergency and urgent care services. So quick example, if you're in Europe, you're walking down the street and you trip and fall and break your leg. That is considered an emergency. So you go to the closest emergency room, they'll take care of you. It's unlimited expenses minus the $85 copayment, right? Moving along, your ambulance copay is $100 per visit. As for outpatient surgery, this is more of like your cataract, colonoscopy, same day type of procedures. It can be between $0 to $150. So 0 would be for if you had it done at an ambulatory surgical center, whereas if your doctor tells you, hey, you're high risk, I would prefer you to have your procedure done at a hospital, that's when you'll be subjected to the $150 copayment for outpatient surgery, all right? Moving along, for skilled nursing, this is typically, let's say you had hip surgery, you're well enough to be discharged from the hospital, but you probably need extra rehab services or extra care. You may be discharged to the skilled nursing, right? So for skilled nursing, the first 20 days is a 0 copayment. Then from days 21 through 100, it is a $50 copayment per day. But do keep in mind, as I mentioned earlier, you do have a maximum out-of-pocket. So the most, once again, for the year is $7.99 is your maximum out-of-pocket for your copayments. Moving along, a lot of zeros for the next few items. So for x-rays, labs, your MRI, CT, PET scans, diagnostic testing, physical therapy, so that could be speech therapy, occupational, physical, right? Also urgent care, all 0, okay? Now moving on to the prescription drug coverage. Blue Shield has a very strong formula when it comes to their medications, so that's where I come in and I can do an analysis for you and let you know what your best options are. So for prescription drug coverage, I'm gonna give you the co-payments for a 30-day supply and a 90-day supply. So it'll be 2 numbers. So for example, Tier 1 typically is the preferred generic. It'll be a 0 copayment for a 30-day and a 0 copayment for a 90-day, okay? Tier 2, generics, it'll be $3 and $4.50. Tier 3, typically brand name medications. This will be a $35 copayment or $87.50. Then Tier 4, what's considered preferred brand names, it will be a $95 copayment or $237.50. And lastly, Tier 5. This is your specialty drugs. Typically, it is chemotherapy medications are prescribed that you pick up at the pharmacy or injectables. On Blue Shield, it is a 33% coinsurance, all right? And on this plan, there's no Tier 6. Now the extra bells and whistles, the fun stuff, right? The extra benefits on a Medicare Advantage plan. This plan does include basic dental coverage. However, if you prefer to use your own provider, there is an option to upgrade your PPO to a PPO option. As for hearing aids, this plan does cover hearing aid benefits. So to get a hearing test, it is a 0 copay. And if it's determined that you do need a hearing aid on the Blue Shield Inspire plan, there are 2 options. You have the silver option, which is $449 per ear, or the gold technology option, which is $699 per ear. The hearing aid benefits is administered through a company called Epic Hearing. Moving along to our vision coverage. Vision, it's a zero copayment for your exam, and then you get a $200 allowance every 2 years to use towards your frames or contact lenses. So you have $200 to use each year, but let's say you have lenses that are, you want the glare-free, the coating, or the scratch-resistant coating, you do pay the difference, okay? So lenses are covered for basic bifocal, trifocal, but if you want the extra bells and whistles, you'll pay the difference for that. As for the vision administrator, it is through VSP. You may have heard about VSP when you're working at your employer. So they work with many of the private optometrist offices, or there's also Lens Crafters, Target, and so forth. Let's see, health club membership. Silver Sneakers, right? You may have heard of Silver Sneakers. They're a company that is contracted with multiple gyms in the area. So you have access to LA Fitness, 24-Hour Fitness, YMCA. As long as you're a member of Blue Shield, you have the Silver Sneakers benefit, and you can belong to multiple gyms if you want. So let's say you like 24-Hour Fitness because they have extended hours, but you like the sauna over at LA Fitness. On this plan, you can be in all the gyms, okay, as long as they participate in Silver Sneakers. As for transportation, if you need a ride to the urgent care, lab, doctor's appointment, this plan includes 32 one-way trips at no cost to you. Now, lastly, the extras that we didn't have on this spreadsheet. This plan also includes a medical alert device. So in the past, you may have seen the commercial, "Help, I've fallen and I can't get up." That's the device I'm referring to. This plan offers it at no cost to you, and dependent on your lifestyle, your activity level, it will determine which device you get. You can either get the pendant, the traditional type, or the bracelet. But if you're a little bit more mobile, you can have access to the GPS mobile device. Once again, at no cost to you. You also get acupuncture and chiropractic services. So you get 24 visits for acupuncture as well as 24 visits for chiropractors. You do have to use a network, which is called the American Specialty Health. But if the provider participates in that network, this benefit is zero copayment for you. Let's see. A few more items, and then I will transition over. Over the counter. So this plan also includes over the counter benefit. What does that mean? You can order items like cotton swabs, hand sanitizer, vitamins, ibuprofen, and you receive a $100 allowance each quarter to use on those items, as I mentioned, right? You can order twice per quarter, so not limited to just one. It is through CVS, so you do have to use them as the vendor. You can either call in or order online. Super easy peasy. And lastly, something new that is offered on Blue Shield this year, home delivery meals, and it's through a company called LifeSpring. So upon discharge from the hospital skilled nursing, sometimes it's a little bit difficult to transition back to normal day-to-day routine. This service offers you delivered meals at no cost to you, okay? That concludes my portion, but just before I leave, so as I mentioned earlier, Blue Shield does offer Medicare supplements, and they have very competitive premiums for their Plan G and Plan G Extra. So if you'd like more information about your plan options, please contact me. My number is 949-226-4064. Thank you again for your time, and I look forward to connecting with you. Alrighty, I am going to go ahead and call in my associate, Alton Smith, and he will be representing SCAN Health Plan today. Thank you.
Hello, are we on? I imagine we are. Good. Excellent. I'm Alton Smith, and I am with SCAN Health Plan. We have a very gorgeous plan we're offering now, the Venture Plan. This plan will provide you with $125 back every month. We're reimbursing $125 of your Medicare Part B premium. So please, you'll see the number on there, 714-865-3344. Give me a call. I'll be more than happy to go over the program and the benefits and what this plan does. If you notice, if you're seeing the form there, zeros all the way down for a lot of benefits, and still you're going to get $125 back of your Part B premium. This is huge. It's called the Venture Plan, and I would love to talk to you about it. Meanwhile, let's take a look at what we are offering as far as a plan overall. So with the Venture Plan, our star rating, 4.5 stars. We have been 4.5 stars 4 years straight. So also, there's no monthly premium. We're giving you money back, so of course there's no premium. As far as your primary care visits and specialists, completely covered, no copayment at all when you go see your primary care doctor, or if he sends you to a specialist. Now, if we take a look down the line, we're looking at your maximum out of pocket. With the Venture Plan, it is $1,000 as far as your maximum out of pocket. Hospital, no copayment. There's no copayment at all for hospital with this plan, okay? And as far as your emergency room copayment, $90 if you are treated and you are released. Inside the state, outside the state, even outside the country, you are covered with it for emergency. And again, it's $90 if you are treated and then you are released. But if your emergency causes you to be admitted to the hospital, we're going to waive the $90. Now, ambulance, under the Venture Plan, ambulance is only $155. I don't know if you've ever seen a hospital bill before, or as far as, ambulance bill. Ambulance is going to be $155. Let me back up a little bit here. I'm excited about our new plan, can't you tell? All right. So you're only going to pay $155 for an ambulance ride. Folks, that is a pretty strong discount, okay? Regardless of what that ambulance may charge, you're only going to be responsible for $155 of that bill under the Venture Plan. As far as outpatient surgery, the copay is either $0 or $225. There's some differences on that. Give me a call at the number that's showing, the 714-865-3344 number. Give me a call, and I'll be more than happy to go over the difference as far as whether it's $0 or $225. Skilled nursing, first 20 days, no copayment at all. From days 21 to 100, it's going to be $100 per day. As far as lab and x-ray, all your lab, x-ray, regardless of how often you go, will be completely covered. As far as MRIs and CT scans, either $0 or $75 copayment. All your diagnostic testing is completely covered. Physical therapy is a $5 copayment with this plan, $5 copayment. Urgent care, no copayment. Now, looking at your pharmacy benefit with SCAN, it's beautiful. Tiers 1 and Tiers 2, generics, you pay nothing at all. As a matter of fact, you can even get a 100-day supply. SCAN works with Express Scripts for prescription drugs, but if you go to any of the retail pharmacies, our preferred pharmacies, so if you're using Savon, I use Savon. If you use Rouse, if you use Target, if you use Rite Aid, CVS, any of those big pharmacies, those are considered preferred pharmacies, and there is no copayment for generic Tier 1 and Tier 2 drugs. Now, if you use a standard pharmacy, Tier 1 and Tier 2 are 7 and 15. So if Tier 1 is 7, Tier 2 is 15. Insulin, under the preferred pharmacy, it is only going to be a $25 copayment for certain insulins with SCAN Health Plan. We also have a plan where insulin is covered 100%. Give me a call. I'll be more than happy to share that with you and let you know. As far as Tier 4, still working with Tier 3. It's a $30 copayment, other than insulin. So, and then looking at Tier 4, it's a $95 copayment. Now, keep in mind, these are preferred pharmacies. If you use the standard pharmacy, it's going to be $35 for insulin. Tier 3 is going to be $42. Tier 4 is going to be $100. Tier 5, 33% of our negotiated rate, regardless of which pharmacy you use. As far as dental, great things again going on for 2022. SCAN is going to provide you with a complete dental plan in 2022. I know you're like, wow, that's great, because it is great. Yes, we're going to do that for you, a complete dental plan. Hearing aids, you're going to spend $450 for a hearing aid with SCAN Health Plan. You can use the more of a Cadillac version at $750, but a lot of our members who have our hearing aids, the $450 hearing aid works fine. We work with a company called True Hearing. So hearing aids are provided. We do have hearing aid coverage. Vision, the way it's going to work, we work with a company called iMed. It's going to be $250 towards your glasses. Your exam is covered. There's no charge for that, but whatever your glasses come to, SCAN is going to cover $250 of that. So if you get a pair of glasses and it's less than $250, guess what? Glasses are all yours at no copayment whatsoever, just like the visit, just like the exam. Health Club membership, we are still with Silver Sneakers. We are still with Silver Sneakers. As far as transportation, you are entitled to 12 round-trip rides or 24 one-way with the Venture plan. As far as the extras, the Venture plan offers some great things. We have something whereas with our caregivers, if you have a caregiver, someone's caregiving for you, you're not paying them, but this is a family member or friend doing this out of the kindness of their heart and their love for you. If that person has to be somewhere, guess what? We're going to send somebody out to cover that, to fill that gap for you, to be there for you. If you're coming out of the hospital with SCAN Health Plan, we have the returning to home benefit. And call us within 7 days of that hospital discharge. If you're unable to perform any of your activities of daily living, do you know that we'll send somebody to help you with the bathing and cleaning and so forth? No charge. This is what SCAN does. We've got some other benefits. For example, if you have a family member who, they're a little elderly, very much on the elderly side, they have problems, and you've seen the commercials on TV, I've fallen, I can't get up. So we have the emergency response system. Ours works like a GPS. And the beautiful thing is, ours, there's no charge for it, no co-payment. And there's more, but my time is limited. So please, exercise the number 714-865-3344. I'm Elton Smith. I've been with SCAN 18 years. I want to help. I want you to be a member of SCAN. After you see all the great benefits and the other plans that we do provide, I'm sure you will also want to be a member of SCAN. All right? Well, it's been beautiful. Hope to hear from you soon. Thank you.
My glasses for these. Okay. Okay. Hi, I'm Rosalie Puglia with AARP, Medicare Solutions with United Healthcare, and I'm here today to talk about our Focus Plan. And let me just tell you, I'm so excited about the new benefits that we have for this year. There's some additions, there's some decrease in costs, and so I'm really excited about it. I want to give you my phone number first. My number is 714-292-3796. And just a little bit about United Healthcare. United Healthcare is a Fortune 5 company, and we have the most Medicare members in Orange County, Medicare Advantage members. So that's pretty exciting. We have star rating is a 4.0 for this year, and the premium for this plan is going to be zero copay. Okay? And then also the primary care, specialist visits, just like everybody else, pretty much the same, zero copay when you see your doctors. All right, so let's talk about some of these other benefits. let's see, the maximum out of pocket this year, this is another reduction, $800. It's down from $1,000 from last year, so that's terrific. Hospitals stay is zero copay, unlimited, and that's for unlimited amount of days. And then also ambulance, another reduction in cost, down to $130 for ambulance. I always tell my clients, call the local paramedic program or the city, and they have a paramedic program, and it's usually $5 a month. That's attached to your water bill, and then you don't have to pay the ambulance fee. However, if you are away, all you'd be paying is $130 for air, land, or sea. So if you need to be airlifted anywhere, then I would suggest this is a great plan, because all you'd be paying is $130. Okay. So the next one, let's see, we have here is outpatient surgery. It's going to be zero copay, whether it's in the hospital or outside of the hospital. So sometimes there are facility charges, but it's going to be zero for you. And one of the things I did want to tell you about all of the benefits here today is that they are worldwide. So if you're traveling to Europe and you need to go to the emergency room, or you need to go to urgent care, that's going to be a zero copay. Now, you would pay the bill and you bring it back to us and they would reimburse you, but it's zero copay. Now, locally, if you go to the ER and you're admitted, that's going to be zero. But if you leave the ER, then it's going to be $90. With urgent care, if you go into your network, then that is going to be zero copay. But if you are at a network, say you're in Bakersfield or someplace like that, and you need to go to urgent care, then it's going to be $20. Okay? All right, so let's talk about some of these other. The skilled nursing facility, that is zero copay for the first 20 days. And then the next 7 days, here's another reduction again. That is $100 a day. And then days 29 through 100 is going to be zero again. So you could stay in a skilled nursing facility for 100 days and only pay $700, which would go towards your out-of-pocket maximum. All your labs and x-rays are going to be zero copay. And then let's see, MRI, CT scans, here's another reduction. It's down to zero. So you don't pay any copay for an MRI or CT scan. It used to be $50. So your diagnostic testing, the non-radiological, is going to be zero copay. Physical therapy, speech therapy, occupational therapies are all zero copay as well. So as you can see, the benefits are really very rich for this year as well. Urgent care. I think I went over that already. Let's talk about the prescription drug plan. So Tier 1 and Tier 2 is going to be zero copay for 30 days and zero copay for 100 days. So that's pretty terrific. Now, let's see. For Tier 3, here's another reduction. It's $35 for 30 days. Used to be $47, so they dropped it $12. And then also for 100 days, it's only $95. So that's pretty good. Tier 4 is $100 for 30 days, and then $290 for 100 days. And then Tier 5 is 33%. Now, one of the things that they added last year, and they're continuing with this year, is insulin. Insulin is $35, and we all know how expensive that can get. So insulin is $35 for certain drugs, and it's remains at $35 through the coverage gap. So that's kind of an exciting thing as well. Also with United, Tier 1 and Tier 2 are covered in the gap if you do happen to reach that. There's no Tier 6. Now, another addition that they have is dental. There's up to 3 cleanings a year, and that includes x-rays and fluorides, etc. And it's zero copay for comprehensive dental, and they're giving you up to $500 for comprehensive dental without any cost to you. There's also a PPO buy-up that is $1,500, so that's pretty terrific as well. All right, Now, we have hearing aids. Here's another reduction again. Hearing aids, $375 and down to, and then up $1,400 for the very exclusive hearing aids. It used to be around $2,000, so that went down as well. Vision, $300 for frames, and then the lenses are included. And then, of course, we have the health club membership. It's called Renew Active. It's kind of a wellness program. It's brain games, it's recipes, it's all kinds of different things that you can do. You can even track your walking. You can track going to having your annual physical. There's certain things that, and you call them, let them know, and they will send you some money for that, up to $150 a year, which is pretty good. Transportation, 24 one-way rides. Let's see now, we have chiropractic and acupuncture. Here's another increase in benefits. 20 visits for each, acupuncture and chiropractic, and that's going to be at zero copay, which is great. Personal emergency response system, that's going to be zero copay as well. You just have to call them and ask them, and they'll come install it, and the monthly service charge is free. Podiatry, if you have ingrown toenails or calluses and you need to have that taken care of, then you can go self-refer to a podiatrist twice a year. But if it's medical, like say you needed foot surgery, like I needed a couple of years ago, then that's going to be zero copay. And now they have a special service. It's called Navigate for Me. And basically what it is, it's a concierge service for you for care after hospitalization or diagnosis with a severe illness, which I think is just terrific that they help. They make appointments for you, they arrange for your transportation, et cetera. And it's very helpful to the members. Now, a couple other things. This year they come out with a new plan. It's a chronic plan. It's a special needs plan for diabetics, heart condition, et cetera. So that is really a great new plan as well. And then they have a new Harmony plan too. There's Medicare supplements and 3 different types of prescription drugs plans as well. So again, my name is Rosalie Pulio. I'd be happy to hear from you and happy to go over this again or answer any questions that you might have. And my number is 714-292-3796, and I look forward to hearing from you. Thank you so much. And we have Henry again.
Thank you, Rosalie. That was a lot of great information. And once again, I want to thank Jeanette, Diana, Alton, and Rosalie for taking the time to present this important information for all of you. And you can find all of this information in this description portion in your YouTube invite or in the information provided to you online. Also, once again, feel free to call anybody that's left you a number if you have any questions about any of the specific plans. Once again, it was a lot of great information. We hope that maybe you'll join us at some of our other Medicare benefits webinars if you're available. And just wanted to thank you again for really taking the time out of your afternoon to spend with us to learn a little bit more about Medicare, the benefits that are coming up for 2021 and 2022. So once again, thank you for your time. Have a great afternoon. We look forward to seeing you again. Thank you.